Holding your pee might not seem like a big deal. We all do it sometimes, but have you ever wondered what's really happening inside your body while you're holding it? Is it harmless? Or can it actually hurt you? Let's take a closer look and find out why your bladder might not be as patient as you think. Your bladder is a small muscular organ that acts like a stretchy storage bag. On average, it can comfortably hold about 400 to 600 milliliters of urine, which is a little more than a regular water bottle. As urine fills the bladder, the walls start to stretch, and tiny nerves send signals to your brain letting you know it's time to go. That's when you feel the urge to pee. Now, most of the time, we go when we need to, but sometimes we don't. Maybe you're stuck in traffic, maybe you're in a long meeting, maybe you just don't feel like getting up. So you hold it, and when you do, your body tells a small muscle called the urethral sphincter to stay tightly shut. That muscle is what keeps urine from coming out, and you're basically clenching it to hold everything in. This isn't dangerous at first. Your body is designed to hold it for short periods when needed. But the longer you wait, the more pressure builds up inside the bladder. The stretching continues. The muscles work harder, and you start to feel pain or strong discomfort. If you hold it too long, or if you make a habit of holding it often, problems can start to show up. One of the first things that can happen is bladder irritation. The constant stretching and pressure can cause the bladder lining to become inflamed, which can make peeing painful or leave you feeling like you still have to go, even when you just did. This is something doctors call cystitis. But that's not all. When urine sits in the bladder for too long, it gives bacteria more time to multiply. That increases the chance of developing a urinary tract infection, or UTI. A UTI can make urination painful, and your pee might look cloudy, smell strange, or even contain traces of blood. And if the infection spreads, it can reach your kidneys, which is much more serious. Another problem is that your bladder muscles can become overstretched over time. If you keep ignoring the urge to go, your bladder may start to lose its strength. It might not fully empty even when you do pee, and that leftover urine can lead to more infections and more discomfort. You might even end up needing medical treatment just to get everything working properly again. Now, here's the big question. People always ask, can your bladder actually burst from holding your pee too long? The honest answer is yes, but it's extremely rare. This usually only happens in extreme situations, like trauma or severe medical conditions. Sometimes it's linked to alcohol, which can block your ability to feel the urge to pee. But in day-to-day life, a burst bladder is very unlikely. Still, that doesn't mean holding it is completely safe. Just because it doesn't burst doesn't mean it isn't causing problems. So, what should you take away from all this? Holding your pee once in a while is okay. Your body can handle it, but doing it regularly or ignoring the urge for too long can lead to real health issues. Your bladder is meant to hold waste for a while, not forever. When your body tells you it's time to go, it's best to listen.